Okay, my name is Tricia, and I will be demonstrating a basic IV insertion today. You would want to start off by implementing standard protocol. So you would look at the doctor's orders and assess the IV type and duration. Look at the lab data, and then look for patient allergies. Then you would want to prepare your equipment. So I'm going to perform hand hygiene, and then I'm going to get a 10 millimeter syringe, and then I'm going to attach a needle to it. I'm going to draw up 3 milliliters of air. I'm going to check the expiration date of the sodium chloride. It's still good, so I'm going to clean the vial.
I just go with the big thing.
And then draw up 3 milliliters of
This is my last
sodium
semester.
chloride.
All together? Last semester.
And then you want to get rid of this needle. I would throw it in the sharps container, and I will attach the syringe to the IV extension set. Then I will prime my tubing, making sure there are no air bubbles, and there are none. This back. Now I will take all my equipment that I need, bring it into the patient's room. Hello, my name is Tricia, and today I'll be your student nurse. Your doctor ordered that you should have an IV inserted today. So can I get your name and date of birth? The patient tells me. What side are you most dominant on? Patient is left-handed, so today we'll be using the right hand. So I will look at I would also choose the arm that, before that, I will ask the patient if he has any allergies. The patient has no known allergies. Now I will choose a vein I will choose the arm that does not have the side of the mastectomy or a renal fistula for dialysis. So after I've chosen my arm, I would look for a vein. We would want the vein that is resilient, bouncy, and soft, that is most distal from a venipuncture, and I would also choose a side that does not affect the ADLs. So I have found my site, I've palpated the vein, and this is resilient, bouncy, and soft. So now I'll go ahead and apply the tourniquet. So I would apply the tourniquet 4 to 6 inches above the site that I selected. Now I will perform hand hygiene and then put my gloves on. And then I would also check my radial pulse to see if it's still there, and it is. So now I will look for my site again. I found it. So now I'm going to clean it with an alcohol pet pad using a circular motion. 20 gauge catheter. And tell the patient that he is going to feel a little stiff. I'll pull the skin taut, like so, and then put it in. I go in at a 15-degree angle.
All right, y'all have to go.
Then I advance the catheter. Look for a blood return. Hold the site, and then release the tourniquet. And quickly try to put this in the extension tube. Now I'll aspirate for a blood return, and there is. I'm going to instill the normal saline. And then I will close the clamp for positive pressure, and then unscrew the syringe. Now I'll just clean up my site. And now I will get my Tegaderm and apply it. Over the hub and insertion site. And remove the etching. Then I would label my initials, date, time, and gauge. Put it on the patient. On the patient, like this. And then I would get tape. But before I put on my Tegaderm, I would assess the site to see if there's any phlebitis, inflammation, or edema. The site is good. Now I will get a piece of tape and secure it to the patient's arm. Like this. Are you feeling any pain? Nope. So now I will go ahead and document. I would document the date and time of insertion, the size and type of catheter, the insertion site, patient response, any instructions given, and the amount of attempts. And then I would I'll do the patient completion protocol. And then I would also clean up everything and then put all the needles in the sharps container and position the patient to how he was earlier.